HealthROSTER is our unique solution for healthcare rostering. It's been designed from the ground up to deliver in a healthcare rostering environment. As we all know, healthcare rostering is one of the most difficult rostering environments that's out there. So what have we done to make sure that HealthROSTER can work in that environment? Well, first of all, it can deal with the complexity. We've designed a solution that is flexible to deal with any healthcare environment. What does that mean? Well, for example, every time we put an individual into a shift, we can test over 150 different rules, and those rules have been designed just for healthcare. Secondly, we can deal with whatever staff group you need to roster, whether it's your nursing workforce or indeed whether it's your medics. And with Circadian, of course, we can also plan your consultants' job plans or indeed your junior doctors' rotas. But it's not just about the nurses and the medics. We can do your allied health professionals as well, and all your admin staff. So we have a solution for all those different staff groups. But here's the unique thing. All of those staff can be brought together on just the one roster. So what does that mean? You have your multidisciplinary teams working together. And finally, wherever those teams are working, we've got a solution for that too. So if you're in an acute hospital, whether it's theatres, clinics, outpatients or a ward environment, we have a solution. Or if you're in community, again, we have a solution. And the reason we can do that is because we have unique location-based functionality for every environment. So those are three reasons why we've got a unique healthcare rostering solution. But as important as those things are the fact that it's easy to use, and that's what we're really passionate about. If HealthROSTER makes the job of putting a roster together any more complex, then clinicians are busy enough already without giving any extra administration burden. So we've come up with something we call one screen, one click. So when you manage a roster, it's ever only on the one screen, and the top 10 things you need to do are just that one click away. You're now going to see a short demo of HealthROSTER. You can see it in action and indeed see what the benefits are that it can deliver.
Welcome to this short demonstration to show how we can link multidisciplinary rosters. Where there are any changes to the rosters, HealthROSTER ensures staff that sit on many different rosters are informed of the change. This obviously aids decision making and ensures efficient use of staff. So to demonstrate this, we're going to look at a theatre list. In this example, there are people from 5 different rosters that are all planned to work on this theatre list. This includes the surgeon, an anaesthetist, a middle grade and junior doctor, 2 registered nurses and an ODP. It's worth noting that the ODP shift is being covered by bank. Now, if this list is cancelled, we can right-click on the duty and cancel the demand. A reason needs to be entered. In this case, it's because no rooms are available. So this affects the consultant duty as well as the multidisciplinary team, and the staff are going to be put on standby. They aren't going to be sent home, but rescheduled into alternative duties. All staff has been cancelled in the 5 respective rosters. These staff have been put on standby on their respective rosters. So to start, we can see on the OBS and gynaecologist roster where the duty originates, and we can see the staff, the middle grade and junior doctor, have had the theatre list cancelled and have been put into standby in orange. Now they're able to be redeployed into alternative duties then. Rest of staff have been cancelled, so under external staff we can see the anaesthetists, RNs and the ODPs have been cancelled and put into standby on their respective rosters. Interestingly, the ODP shift was covered by bank, so we can cancel that bank shift and save money because the information is sent to the bank office immediately. Now, if we look at theatres, it's very quick and easy to see for the theatre manager that their RNs are no longer needed on that list they were scheduled for and have gone into standby. We can see that we have some vacant shifts on that Monday, and that would have been filled by bank staff, but now we can allocate them to our substantive staff on standby just by dragging and dropping the shift, thereby making the most effective use of staff and ensuring we don't use bank and agency staff unnecessarily. And by linking roster, it gives you a clearer picture of what's going on across multidisciplinary teams, aiding decision-making and ensuring that you make the most effective use of your staff across the entire organisation. All rosters in HealthROSTER require approval before they can be published, and the data are automatically sent through to HealthPerform. And this short demo will show some of the key performance indicators that can help managers to determine if they've produced a good roster or not. In this example, we can see that we have the Approve and Analyze screen up for Orthopedics ward. Now we can see some of the key performance indicators highlighted to us, and this particular roster is in budget, but we can clearly see it's ineffective as we use a simple RAG rating. This draws our eye to where we have some problems. Now we can see effectiveness is a big issue for us, and this is because we're not using our staff hours effectively. There are 84.3 unused hours, and these are hours that we're paying our staff for but haven't scheduled them to work. We're also scheduling over demand. In fact, we're scheduling 45 hours of additional duties. Now, bearing in mind this roster hasn't yet been published and it normally would be produced 6 weeks in advance, we're not likely to know yet if we need to increase our demand for reasons such as higher levels of acuity. At the click of a button, we can see where and why we have created additional duties. All of the shifts are on a particular week, and the reason is because we're using up staff hours. This is linked to some of the other KPIs. In this case, it's because we haven't managed our leave very well. We can see the approval screen has highlighted on week 3, and we have too many people on leave, and in week 4 we don't have enough people on leave, and the additional duties are being created for week 4 because we have too many staff available, as we haven't put enough staff on annual leave. The approval screen allows us to quickly and simply see where we have particular problems in the roster, where we're out of budget, where we have unsafe or ineffective rosters, and if we're being fair to staff. If rosters are approved with issues, these will be filtered through to HealthPerform and therefore escalated to the relevant people in the trust.